So it's 7:30. We're going to go ahead and start. I'll start with my introduction first. My name is Holly Farbo. I am the Senior Academic and Industry Relations Manager for Hygiene. I am a hygienist. I've been a hygienist for 21 years. I was a hygienist in private practice for 19 of those years. And I went to an Aspen Dental April of 2018. And I fell in love with the model and the way that we saw our patients and everything about it. About a year later, this job came available, and it was a chance to talk to students about Aspen and spread the word, and I was on board. So that's where I am at today. And real quick, I just want to go over about a DSO. So generally some people understand what a DSO is, some people don't. A lot of people call it corporate. So I just want to explain a little bit first about what a DSO is and that kind of model, and then I'll have everybody introduce yourselves and we'll go with questions. So basically it's a dental support organization. And some people say, well, why would I want to do that and not just do private practice? So basically, if you come out of dental school as a dentist and you open a private practice, most of the times, even if you don't have a ton of student loans, you're going to have to find a place for your office. So you're going to have to find, a real estate agent. And then you're going to have to get your computer system set up. So you'll have to have an IT person. And then, most of the times they don't teach you about marketing and payroll. So you'll have somebody doing your payroll and marketing. You'll have to have an accountant. So there's a lot of things that are involved in owning an office than just walking out and opening an office. That's where we come in. I work for Aspen Dental Management, which is the management side of it. So all of our offices are owned by dentists, and the dentist and the hygienist and everybody in the office takes care of patient care, and we take care of the rest. So we are marketing and recruiting and legal and everything else so that the doctor and the hygienist can focus on patient care. So I just wanted to really quick go over that. And so we're going to start with Dr. Divya. We'll go ahead and let you introduce yourself and tell us how you got to Aspen.
So I am Dr. Divya Swarup. I have been with Aspen for a year, but not new to dentistry. I've been a dentist since 2002. I'm really, really old. But so I started dentistry in India, and I did my residency in Perio. So I am a foreign trained periodontist. I've worked as an associate professor in the Middle East. I've been doing periodontics and implants and doing general dentistry as well. I owned a practice before we immigrated. And once we came here, I went to Boston University, where I redid dentistry. So I've done 10 years of dentistry after school. And that completed in 2015. And with me and Aspen, it's been a long story. I was trying to come to Aspen, but there were phases in life that I never got into Aspen. But I cannot tell you how much satisfied I am. What you just said about the billing. I was a dentist who was paid based off my collections, and there was always something. There was always something going on with insurances. There was always something going on where it was, things would just affect me, which should not be affecting me. And I wanted to focus on my patients. I wanted to focus on my patient care and dentistry. But apart from that, I was focusing on other things. And being with Aspen, that gets taken care of. I'm very, very passionate about hygiene because having a background in perio, I have to see every single pocket. I have to chart it. It has to get taken care of. If we have to do local drug delivery, I'm not going to say yes for a regular cleaning when a patient has pockets, because it's just embedded in me. We have to treat what is there. We're not over treating, we're not under treating, we just follow protocol. If a patient has disease and it's not getting treated, we refer them to perio, we keep them on maintenance, we go by the latest norms. And I cannot praise it enough. Like, staging and grading came in 2017 and 18. We implemented it right away. All our patients are staged and graded. That's how we make our referrals. That's how we make our diagnosis. And I'm proud of that we do that. So I think that we follow protocol and we follow, we follow the book. So that is the best way that you can do dentistry. That's the best way that you can do hygiene.
I agree. Thank you, Dr. Divya. Thank you for joining us. I'm just going to go across my screen, so we'll go next to Sarah. Sarah, would you like to introduce yourself and tell us how you got to Aspen?
Okay. Hi, my name is Sarah. I started with Aspen almost 9 years ago. This is my anniversary month towards the end of the month. I started with Aspen right out of school. I had moved home from the Cape to Springfield, Massachusetts, and was looking for a job. Aspen had a job posted. I went in and interviewed and got the job, and here I am today, almost 9 years later. It's been wonderful for me. To be completely honest, I took this job thinking I was just going to get my experience and move on because I hadn't heard the best things about corporate, quote unquote, dentistry. But here I am today, 9 years later. I've never looked back. I've been able to practice exactly how I learned in school, by the book, per the AAP guidelines, ADA. I feel very proud of what I've been able to do here for my patients, and very blessed to have the opportunities that I've had as a hygienist, which has also brought me into the management side of things as well, that I probably wouldn't have had this opportunity had I chose a different route.
Great. Thank you, Sarah. Thanks for joining us. Jackie, we'll go to you next.
Hi, I'm Jacqueline Harrison, and I've been with Aspen for almost 4 years. I started my dental career very early on when I was in the military as a dental assistant. And then I took over that dental clinic and I worked side by side with the hygienist. And that's when I realized I wanted to get out and go to dental hygiene school. So I worked in private practice for a few years before I relocated back up to New England to be closer to my family. And I needed a full-time job. And just like Sarah, I had some reservations from the things that I had heard about corporate dentistry. And so I thought, I'm just going to go here until I can find something better. And here I am 4 years later. And Sarah Erickson actually trained me. And I remember my first week into training just being in awe of how everything was done by the book. And from that prior military experience, that's the way that I love to live my life. So I just fell in love with Aspen, and it's my forever dental home.
Great. Thank you. Thanks, Jacqueline. Okay, Amber, let's go ahead and introduce yourself.
Hi, I'm Amber Lombardi. I'm a dental hygienist in Maine, actually, the South Portland location. I've been with Aspen for just over a year now, and I have a very similar story to everyone else. I actually grew up in the dental field. My parents have owned multiple practices. My dad's a dentist, and I was made to work in the office since I could ever remember. So I've actually held so many different, I've assisted, I've done every office management, every position, I think. And then I realized working while I was there managing the practice that I wanted to be a hygienist. So here I am years later, still absolutely loving my profession. Aspen was an amazing fit for me for so many reasons. I can echo everything everyone else has said. For me, the most important thing was they were really supportive that I actually have multiple interests in the hygiene field. I'm a public health hygienist, and I also teach per diem at the local university. And they've been so amazing with being flexible with my hours, and it was just a really good fit for what I needed. I feel like I've grown since I've walked through these doors. I learn something new every day. Being an educator, I really appreciate that they follow all the guidelines, like everyone said. I'm extremely passionate about perio and hygiene, and it's something that things I do during the day at work, I can bring to my students at night when I teach a night clinic. And I think it's really, it's been a really great fit for me. I see Aspen as my family, and I can see myself being here for many years.
Great, thank you, Amber. To anyone that's joining us, there is a little question and answer box at the bottom of your screen. If you have a question, you can go ahead and submit that question and we can answer that for you. So we'll start with some questions that we have here. The first one is, why would I want to leave my private practice after 12 years to come to a DSO? So we can start with Dr. Divya. This can go for dental, this could also be a dentist who says this, or a hygienist. So, you want to give your answer on that?
So the person who asked this question, I would ask them, like, what are your goals? If you've been in a private practice for 12 years, are you satisfied and happy? If there is something that you feel is lacking, that place can be changed, because as you girls are there, there's tremendous growth potential. If you're just as a hygienist or as a lead hygienist role in the private practice that you're in, could you ever transition into something like a trainer? Maybe tomorrow, if you're having some kind of personal issues, a lot of private practices did shut down during this pandemic or was not able to provide hours. With Aspen, that job security is there. None of the employees were let go. We were, able to restart back. We were able to get PPE before any private offices could. So I think the safety environment, and growth-wise, how long do you think you can keep going with that private practice? Do they ever give you opportunities like being a trainer, being a hygiene head? I think those roles only exist with a bigger organization. So that's one reason that I can give you. But from a personal standpoint, you have to tell me what makes you happy and what doesn't make you happy in the practice that you're in, for me to tell you what's different in Aspen.
Great. Then Amber?
Yeah.
Did you want to say? Yeah.
I don't know if I'm supposed to raise my hand.
You can. You raise your hand and we'll just go to you.
So, and absolutely everything she said, I totally agree with. And also so what I've been telling a lot of new grads, anybody, not even new grads, but I work with a lot of new grads, and anyone who's interested in looking for a change, again, people every practice is different. And what I want to say, I know people call this corporate dentistry, but people have to remember that all of these places are still they're owned by dentists, right? So every practice you go into is different. The staff is different at every place. So I always tell people, you just go in and see for yourself. See if that place is the right fit for you. See if it's what you're looking for. For me, the draw for me, why I felt at home and comfortable, a few things. I knew that, God forbid anything happened in a life situation and my husband couldn't be the benefit provider in my life for my family. I knew that Aspen could give me benefits, full benefits, really, really amazing benefits, great health benefits, 401k, all of those things. Not a lot of private practices are able to do that for a lot of reasons. I mean, it costs a lot to run a practice. There's a lot of overhead. So that is a huge, factor for people. And that I think is a really great thing to, just take a look into. Another thing is the training we offer. I think I saw someone post a question down here. What kind of support do you offer new grads? No matter if you're a new grad or if you've been a hygienist for 15 years, if you're joining our team, you're going to get the support right out the gate. So not many times when you go and start to work in a smaller private practice do they have the time, the resources, the staff to provide you with adequate a long enough training. Yes, you get training, but you're kind of like thrown in there and you make it work, right? We've all been there. But for Aspen, you get a few weeks of solid training, and you kind of go at your own pace, and they slowly ease you into the process of getting used to our flow, because our flow is a little different, and I'm sure we're going to talk about that. But you feel really supported, and they're not going to make you quote unquote start in until you're ready, and they know that, you know, they're going to encourage you. And I just think it's a really great environment to you feel really comfortable starting into the new office, and you have room and you have support, people like Sarah and like Jackie who are there to, that's another level of support that you don't have typically in a smaller practice. You have your hygiene directors and support where I can send Jackie a text and say, I'm really nervous, you know, I'm not feeling great about probing today, like I need a little more support on it, can you give me some pointers? Continuing education is another thing that Aspen provides that for you, which is just a huge thing. They're really big on education, making sure that we're following all the updated guidelines. If we have changes, anything new comes out, you immediately get an email, your team's on it. So I think for me, I guess the bottom line, I'll stop talking, but support stands out to me in everything I'm saying. You're very supported, and it's just a really great opportunity.
Let me just really quick go back this, and then Jackie and Sarah will get to you on this. For the question that said, how do we support our new grads? So I work specifically with new graduates, and we know that a lot of times their biggest fear is like, okay, I'm seeing a patient here. I have 4 hours to see one patient, and they're so fearful of walking into an office and having to see 10, 12, like this huge amount thrown in front of them. Okay, so this is kind of a twofold question, and based off of this, how do we treat our new grads? Or for that matter, me coming into an office, I felt the same way, you know. I mean, I still had, what kind of structure do we have for our new hygienists coming in, new grads coming in? How do we prepare them to, you know, have a full schedule or go to that? Jack, you want to start?
Yeah, I'll start. So I think when you're going through that 2-week training, or longer if needed, that 2 weeks is given to newer grads and to tenured hygienists as well, right? And if at the end of that 2 weeks, they've been seeing patients on their own, and we're really looking at their timing and the areas that they're still struggling. And so I can say that up in New England, when we transfer someone into an office that's a newer grad, those appointments are extended. And I think we just put a newer grad last year in Dr. Divya's office, and all she did was communicate that to us. And we extended those appointments to an hour and a half for several months for her. And then she came to us and said, hey, I'm doing much better. I don't need that timing. And so even for some of our tenured hygienists that have been in the field a while, our appointments are very comprehensive. We do expect a lot from our hygienists, but we're by the book. And so sometimes in other offices, perio charting may go by the wayside, or full mouth series may take an extra couple years to get. We give people that time. And so they just have to communicate to us what their schedule needs to look like.
Okay. I'm going to go back to that question, but first, Sarah, there's a question that's posed that I want you to go over real quick, because since you're the regional manager, and it's basically how does our application system work? How does someone apply? And it says on the website, there's mostly information just about patients. So where would someone go, and how does that process work with applying for a job?
You can go to our website, or you can go straight to aspendentaljobs.com. If they do go to our homepage, it's down at the bottom for career opportunities, and they're able to search from there. We also do post to different platforms, hiring platforms such as Indeed, and others, I'm sure. But you can Google us. You can go to our website, aspendentaljobs.com, and we get your contact information from there and reach out.
And I will include my email just in case. I'm always a contact for anybody that I can put you in the right direction, depending on your area and where you live, with the proper people to get you an interview or to speak to you. So let's go back real quick about the training. Can you guys explain a little bit about, and Dr. Divya, I'll talk to you also about the dental, what we do for our new dentists. But first, for HOP, okay, I'm going to say those words, not everybody understands what that means. So if we can maybe hit on that a little bit and what that means and what we do there.
Yeah, so I'll jump in for that question. Sure. So we just revamped our entire onboarding process. And so like Holly said, HOP stands for Hygiene Onboarding Program. And so it's a set 2 weeks where you're interacting in the office, and then you're also interacting with the Vice President of Hygiene and the Director of L&D for Hygiene that are in Syracuse, along with our vendor partner. So you're working side by side with your hygiene trainer in the office. And then there's certain times where you'll step away for virtual training, whether that be more information about electric toothbrushes, our partners with Aura Pharma and DenMat. And so it's for those newer grads and hygienists that have been with Aspen for 20 years. As long as the class isn't full, they can sign up and sit through that class for an hour and learn more about the adjuncts that we offer. So it's a good guide. Obviously, patient care can go either way. And so we're flexible with our training for the actual trainee. Where do they need the most training? So it's still in its pilot stages for the new program, but it's going very well so far.
I've gone twice to HOP and I loved it both times.
Me too. I love that.
Yeah. So, and this is again, a lot of times new graduates in the dental end want to know, about mentorship, or what do they do? Am I required to walk into an office and see, do 10 fillings a day, or how does that play out for a new dentist coming into an office? Oh, you're muted, Dr. Divya. I'm sorry.
So usually new dentists are hired as an associate, and they will always have the practice owner or the MCD in that office who's going to supervise. Most of the treatment plans will come from either or. And same thing, if you need extended times for 2 fillings, if you need an hour and a half, you begin at your pace. When you find your rhythm, you are able to switch. There's one thing that I admire a lot, and this is not just a saying. There are certain things of Aspen that they say that they live by. One of them is treat every patient as if it's your mom in the chair. So if your mom has pockets, if your mom has periodontal disease, what would you do? Wouldn't you want to put the adjuncts in there? Wouldn't you want her to start using electric toothbrush and get those under control and save her teeth? If she's having a cavity, so you treat a patient as if it's your own family member. That's one of our core values. That's what we go by. So if people spread stuff like, oh, there's so much to do in the hygiene appointments, there's scaling, there's adjuncts, there's a reason for that. Just step back and think, any of the newer grads, what would you do? Whether it's dentistry, if you saw a cavity, what would you do if it was your own family member? And all the answers, all the treatment plan will flow right out. There's nobody, pushing you to do it at a faster pace. Sometimes it's like, yes, a patient is booked for SRP, but they only have 6 teeth in their mouth. You don't need the whole hour for that, but you'd still, so as time goes by, you can tweak your timing, you can tweak your schedule. Hygienists are allowed to make phone calls and move their patient schedule to bigger, smaller. They can call their own patients. Same thing, new dentist, you always have an MCD. There's, for new dentists, there's implant support. There's Invisalign and clear aligner support. So there are so many people that you can reach out to. I mean, you just have to try to reach out, and there'll be somebody helping you. A staff member is being mean to you, there is somebody to reach out to. So you don't get back, when you're not with an organization. I do feel that there is a lot of support and a lot of things that are going right.
Okay, so one of the other questions, and this is always a question that comes up with any DSOs, is that we have to sell, okay? So there's a big sales aspect, and that we have quotas. So can you guys talk a little bit on, the selling aspect or quotas? Do we have those? Do we have quotas? Amber?
No, no, and I've never felt pressured to sell. I hate even saying sell because I don't sell anything to anybody. For me, I treatment plan what my patient needs, point blank period. I've done it in private practice before I got here, and I did it from the second I walked through the door here. And we, like at Aspen, we sell Oral-B toothbrushes. We don't sell any other brand. That's the brand we happen to sell. But I don't, I recommend that to my patients, but I don't push that on my patients. Same thing with putting them on a medicated rinse after their SRP. If my patient needs that, then that's what I recommend for them. Do they have to buy that? No, they don't have to buy that, but I'm going to treatment plan my patient properly. Every single patient that sits in my chair, I'm going to treatment plan what they need. At the end of the day, they can refuse whatever they want to refuse. And I get that question all the time from my friend, most of my friends that work private practice, they hear these rumors of I have to sell, or I'm only working on production, all of these things it's just not true. That's not how it works. So just know that, you're going to go through a training, and you're going to be treatment planning according to all the guidelines. And so you, as the provider, you are a provider, you're going to make that decision of what your patient needs.
Right. So, Sarah, I'll ask you this question since you're on the management end of it. One of the other things that we hear all the time is that, and I hear these complaints, I see them online, is that we've pushed them into financing their treatment. We try to make this treatment available to them. So how does that work with, once a treatment plan is executed, how does the patient how does that get discussed as far as finances, and where do we go from there?
Well, I see it from a completely different light. We have financing available to help our patients get the care that they need. If I were to walk into an office and need care, I would likely need a payment plan. Our financing makes that available to them. It's not something that's pushed. It's there for the patients if needed to break their payments or into monthly payments. So it's really to help them get the care that they need, not something that's selling or pushed or anything of that nature. I mean, again, at Aspen Dental, we're all about breaking down the barriers to care, making it easier and more accessible for patients to get their care. One of the biggest things that holds patients back usually is the financial end of it. And that's one of the ways that we are able to help them.
Great. So just real quick in my own, Jackie, you go. I can talk later because I'll talk all day.
I just wanted to add in about the financing piece is the financing that we offer, it's not specific to Aspen. This patient could go home and get on the internet and get the same exact financing. And when I worked at a private practice in Virginia, if they couldn't afford it, they gave them a, Care Credit or Genesis pamphlet and said, let us know when you want to do it. And we're just taking the middleman out. So the patient is there with us. We're doing it with the patient. They have to sign off on it, but they could get it on their own. So it's not something that's specific to Aspen where we're setting the interest rates or something like that, because I have seen those comments online as well. these are all types of credit cards that are offered online. So I just wanted to clarify that.
And a lot of these have 0% interest for, like, 18 months. I mean, they're all, I believe, fair. Unfortunately, a lot of our patients are patients who haven't seen the dentist in a long time, and there is a lot of work that needs done. Sometimes what happens is you go to another office and they'll say, oh, well, let's just do one, and then do one. And by the time they get to everything, teeth are starting to fall apart. So we give a comprehensive treatment plan for a reason, and we try to give the options on how to get that done. So that's one thing that I really liked about Aspen. So how does your new patient exam go? So as far as, how do we treat new patients differently than some private practices? Who wants to tackle that one?
So I'll take that.
Sure.
So typically, private practices will charge you for a comprehensive exam. You will get charged for an FMX. Some of them will offer you a simple cleaning, a regular cleaning that day, and you'll be charged for the cleaning. I've seen that happen in private practices, regardless of the probing depth, regardless of the periodontal status. And then if they need SRPs, that's additional, it's told off later. With Aspen, a lot of things we're giving away for free, which no private practice will do. Our exams are free. Our x-rays are free. There are people who get their x-rays printed and get consults done at 3 other offices. We don't charge a single penny for giving them the x-rays. There is a comprehensive periodontal charting during that exam, and also a dental health scan. So they have all of this done. After that, we come to a treatment plan, pretty much again, just textbook, which would involve first their hygiene, any restorative, any prosthetic, and if they are going for implants, we're now offering a CT scan. If they're going in for Invisalign or any clear aligner therapy, then we do that post all the hygiene and the restorative. So like I said, we follow, if people who are recent graduates, it's always phase 1, then followed by the next phase. So we try to follow everything. The consultants will give them the entire comprehensive treatment plan. It doesn't mean that the patient has to get everything done that same day. There could be things which are staged and phased according to the urgency. If a tooth needs a root canal, that might come before the other smaller fillings, to get them out of pain, or if their wisdom teeth are bothering them, that might come before we do any kind of clear aligner therapy. So it's very, very methodical. It's very thought of. And that's why our new patient appointments are 45 minutes to an hour long, because we go through everything. And then after that, we, once the patient is ready, then they're scheduled. We try to do same day things in terms of, let's say a hygiene opening is there. We could have the patient get their prophy the same day if they need a prophy. But if we don't have availability, then we'll try to schedule you as soon as possible. Because here's how we think. It's like, we think when a patient is walking through the door, they've obviously come to the dental office because they need something, right? They just didn't come for a stroll in the park. They came because they wanted to get their cleaning done, probably a whitening done, maybe there was some sensitivity somewhere. So they came in with a certain viewpoint or a certain need. We try to understand that need and then help them get to wherever they want to be. They want to have a rock star smile, all white teeth, whatever the patient is looking for, our aim is to help them get there. So our new patient visits, we kind of try to make that relationship and connect with our patients, building that trust. But our exam is very thorough because we're doing the FMX, the dental health scan, the probing, everything.
Great. Thank you. Yeah, Amber, I was going to come to you anyway.
I was just going to add on to it. She said it actually at the end. My part in this, when I go into the room, so as a hygienist, you also have that first contact with the new patients. So it gets worked in your schedule, and it's very doable. As hygienists, we build our own schedules. So I get to go into those new patient appointments, and after the x-rays are taken, I know in my practice in Maine, the assistant takes the x-rays, seats the patient, does all the dental charting, and then I come in the room. And for me, it's really important. I really pride myself on taking that time very seriously, and not, staying on time, but also not rushing, not making the patient feel like they're just a number. Because the second I walk in that room is I'm going to start building that relationship with that patient. And a lot of times people don't always understand that hygienists, the scope of practice a hygienist has, and really what we do. And we see a lot of patients that haven't been to the dentist in a long time, or have been in the same private practice for 15 years before their doctor retired, and they never ever got their probing deaths ever done, things. So we're doing new things where they're having new experiences with us. And sure, do we get people in that just want that pre-exam? We do. But I will tell you that a lot of times by the end of that appointment, they're like, oh, okay, yeah, I do want to schedule here. I do want to get my cleaning here. You just gave me more information than anyone's ever given me about my mouth. And so it usually starts out, I would say 9 times out of 10, they come in for, they either just want their teeth cleaned, or they have one tooth that's bothering them. They don't want to hear about anything else. And for me, those people, I see that as a challenge, and I take that time. I actually do a little oral health instruction when I'm in there. I'll do all the probing deaths. We do all the we chart everything in the mouth. And then I assess their radiographs, and then I will do my hygiene treatment plan. And what's really great about that is all the doctors I've ever worked with at Aspen work with me on that. We work together. They'll check my treatment plan. Sometimes we discuss, because sometimes I'm kind of on the fence with something, but I feel very supported and I feel respected in what I treatment plan. Now, I always explain to my patients when I go in there that Aspen's a little bit different than maybe what they're used to going in a private practice. I explain it as kind of an a la carte type of thing, just because I feel like they don't, when they get out to the front desk, when they're trying to schedule, or they get the printout of everything they need, not everybody is versed in all the same dental terms we are. I like to tell them that we are doing a comprehensive exam. We're looking at every single tooth in their mouth, and our job is to look at their mouth and try to get them to optimal health. So we're looking at the long-term end game, but they get to choose what they want to do. Ultimately, they can choose one thing at a time. Obviously, we follow guidelines. So if they say, you know what, I don't want an SRP, I just want a regular cleaning, we will respectfully say, you know what, we can't undertreat you. We're not going to over or undertreat you. We're going to treat you for what you need. So but that doesn't happen a ton. People really respect and really like talking about, learning new things. And I think it's really great to give people information and really take that time to connect with your patients and establish a relationship right off the bat. And I also love, immediately starting that oral health conversation, saying, hey, I can't see you today for this cleaning. I'm going to see you in a couple weeks. But in the meantime, why don't you work on your flossing? Why don't you try to brush one more time a day? So you really do get to have that experience and relationship before they're even in your chair officially.
Right. Okay, so let me just really quick switch gears here for a second, and I want to go to Jackie and just give us a little rundown of your title is Division Director of Hygiene Support. What exactly does that mean, and how did you get to that position?
It's a great question, and I would say that there's 2 different answers, pre-COVID and post-COVID.
Okay.
But I was recently promoted just this past month from Territory Manager of Support. And so thank you. I'm really excited because I get to stay in New England. I mean, I'm open to relocate down the road, which with Aspen is a great aspect if I get tired of the snow and the cold. But I'm here for the long term for the most part. So I went from having a territory where I was going into the offices on a daily basis and having touch points with the hygienist to now I have territory managers of hygiene support that are on my team. And so I'm really helping support them and more so helping support the doctors as well from afar. And so we partner with our POPs, our owner doctors, like Amber and Dr. Divya said, our offices are individually owned by dentists and we handle their support. And so when those AAP guidelines change and update, I'm there to help support the doctors so that they understand these changes. And I'm there to help coach and develop those territory managers so that they can better help coach and support their hygienists.
Great. Okay, so Sarah, we're going to go to you since you are the regional manager. And can you give us a little rundown of what your position is and how you got there from hygienist?
Okay, my path was a little different. I started off as a clinical hygienist for about 6 years, and then I went into hygiene management for a year and transitioned to the regional management. Basically, as far as regional manager goes, you're partnering with your doctor owner and you're helping them run their business. So you're recruiting, you're hiring, you're helping really support them in any way that they need. I know Dr. Divya was talking about earlier about support in general. We have people, we have a network of people for whatever we need, but it's really just helping partner with the doctor to run the practice, supporting the team's needs, no matter what position.
Great. Perfect. So, you know, big thing, we're going to come to this now, but is that a lot of hygienists down the road, some love just being, you know, in the clinic. That's what they want to do for their whole careers. They love patient care and that's what they want to do. But there are hygienists out there who say, what else, you know, and that's where I was, you know, for 19 years, I was a hygienist in office. And when I came to Aspen, I loved the Aspen model, but I was looking for maybe something non-clinical, and it led me to this, which I absolutely love. And I'm a huge Aspen cheerleader, so I get to cheerlead all over the country. So that's great. So we're going to come to COVID, and we're going to talk a little bit about how your patient appointment is different. Dr. Divya, do you want to start with that? How is your patient appointment different now with COVID?
So I think that we're really lucky to live in New England because we fall in the bottommost states in the country for the number of cases, apart from Massachusetts. So, you know, Maine region, New Hampshire region, our regions are luckily on the lower spectrum. But as far as COVID is concerned, first, even before the patient comes in, there's a COVID screening, like on the phone. Have they traveled? Are they have any contact with anybody who's been positive? If they're running any temperature or symptoms, we let them know that there will be a screening and a temperature check when they arrive. If they give us any history of travel, we just refrain them from coming in unless it's an emergency. They can do a teledentistry visit. And so our screening and our, you know, trying to protect our team starts even before the patient comes. Once the patient comes in, they are checking in from their car. There are no more than 3 patients 6 feet apart in the waiting area. So we have checkpoints at every single point. And then we have screens put up for our front desk. So the patient stays 6 feet away with a plexiglass screen, and the front desk is sitting behind so that our front desks are protected. Everybody's wearing masks unless they're in a room, and only then they take the masks off and they put the masks back on when they leave the room. Apart from this, we are also doing the COVID screening and temperature check for the patients. As far as the appointments go, the state guidelines are 15 minutes when your aerosol procedure ends, because now ultrasonics are back for hygiene. 15 minutes at the end of when you stop, you are able to clean your room. So when your ultrasonic stops, the time clock starts from there. So you can let everything settle down. Luckily, I know my office is designed that way, that we all have back doors, which we open and let air in and out. We're using high suctions. There's special relief and HPE sections that are provided to all hygienists, taking off most aerosols. And I don't want to jinx, but there's been no cases. So I think whatever we're doing is right, because if we weren't following guidelines, something would have shown up.
Right.
So I
Absolutely.
think this is what we're following. Same thing, extended appointment times. If you need time to clean, it's all available. And as far as PPE is concerned, you do get your your N95 masks. You get gowns, disposable gowns. You get shields, and you get everything good with the PPE. Also, I'm gonna mute
Good.
myself.
Great. Does anybody else have, oh, let's say hi. Anybody else have anything else to elaborate on the PPE or the COVID
I have
situation?
one really quick thing to say, just as
Sure.
a hygienist. I know I'm part of a lot of hygiene groups, and I just want to say that I feel safe. I was really nervous going back because I think everybody was, it was like an unknown, this is a completely unknown territory. But I will say that I feel very safe. We're following all the protocols. The second something changes, we're all notified. Aspen has been just on top of it. So I feel incredibly safe. I'm provided with PPE. I asked for, I don't even remember what it was. I asked for something extra and they got it right away. They got it in, and it was just a preference of mine. So I was more comfortable in the gowns. And so the office provided. And so I just want to say that I'm very comfortable, and I'm a fanatic about infection control.
Yeah, right. On that note, as far as, you said you asked for something and you were able, how does ordering go? Are you responsible for your own supplies? Do you have to, order from a certain place, or is there a budget? How does that go? Is someone, Jackie, you want to?
I can answer that. Yeah. So you are given like a hygiene budget. The best way to explain that is you are given an allowance every month to buy anything hygiene specific. So there is also a dental order that the lead dental assistants are in charge of. So anything that's communal in the office, like gloves, masks, cavi wipes, those are all put on the dental order. But it is the responsibility of the hygienists that are in the office to order the supplies that they need bi-weekly. So we partner with a bunch of vendors. So if it is on our ordering rec site, they're allowed to order it. And we have all different types of instruments. I know that tenured hygienists, that is exactly what they ask during their interview, is what is in those cassettes and how old are they?
Yeah.
You as the hygienist are in charge of that. And so if you need a new ultrasonic tip, you order it. And so even though you have that allowance, if you have a higher patient flow, for whatever reason that might be, maybe it's the end of the month, people's benefits are running out, your schedule is full, you can put in an emergency order, or you can go over that allowance. If the patient need is there, we allow it. So we're never going to not let someone order something because they're close to that cap of an allowance. It's all about patient care, and we don't want the patients to go without something because their order day falls on a Friday and not a Monday. So,
Right.
yeah.
So a lot of questions we get with work-life balance. How the office hours, is that something strict down the board, or do certain offices have certain hours? Who determines, office hours, and how does that work with work-life balance? Somebody?
I can take this one.
Yeah, sure.
We work with you. It depends on what you're looking for. Are you looking for part-time? Are you looking for full-time? I know one of my hygienists recently, due to COVID, was having trouble with childcare. So I asked her, okay, what can you do for me? So, and we figured it out. We're a family at the end of the day. We need to be cognizant and aware of things everybody's going through. We're not going to at the end of the day say it's all or nothing. You know, we're going to work with you. So, you know, we're really flexible with that.
Good. Dr. Divya, I know you have a visitor with you, but so for your office, are you the POP, MCD? What is your
So I am the MCD.
MCD? Okay.
Yeah, my office is in Amherst, New Hampshire. So yeah, that's me.
So your office hours, is that something that you have control over, or who determines the office hours there?
So like Sarah just said regarding the flexibility options, I've had hygienists who had, who wanted to come in early in the morning and work 7 a.m. to 7 p.m. because they only had childcare for 3 days and they wanted to make max of it and not work for 2 days. We work with people's schedules. We understand family. We understand post-COVID, it's been so different with everybody trying to get childcare or trying to figure their schedules out. We work with people to make it happen. So I think that office hours are not something which is a very big concern. Obviously, if somebody would say, I can only come in and work one Saturday a month for you, that is not practical. That won't work for any one of us. But more or less, I think we're pretty. Sorry.
That's okay. Great, thank you. So one other question that we always get is, do you work on commission? Who wants to take that?
Amber, do you want to take that one since you're still working clinically?
Sure. No, so I don't work on commission. I get paid an hourly wage rate. If I'm not answering this correctly, let me know, but I get paid hourly. I don't know how else to, no, I don't know what else. No.
I
don't even know, I don't know how that would work otherwise, but go ahead, keep going.
Go ahead, yeah.
It is a question that still comes up in almost every interview. Somehow this type of information has leaked out that DSOs, corporate dentistry, is commission only. And so it is a question that we field at every single interview. We are not commission based at all. So all of our hygienists get their hourly wage, and then they are eligible for profit sharing. So we do a profit sharing incentive once a month for the hygienists if they're eligible on top of their hourly wage. So even if, they don't get that incentive, they're still getting their guaranteed hourly wage.
Perfect. So Amber, in your office, are you a single hygiene office, or are you two hygienists?
No, actually, well, we're going to be 3 hygienists now as of today, I think.
That's awesome. And how does that structure go? Is there 2 associates, 2 leads? How does that work?
Yeah, we have 1 lead right now. So this kind of plays from your last question into this question. I'm officially part-time, almost full-time. We have 2 full-time hygienists, and then I'm the third. I call myself the third because I'm not officially all full-time every week. And so we have 1 lead hygienist, and all that means is, he's responsible for making sure that we're keeping up on our trainings, that we're doing we actually work together ordering now. So there's a few more responsibilities, new trainings in the office, things like that. But again, we're a team. We really work as a team. But he might have some more meetings with Jackie that I don't necessarily have and things like that. But yeah, so there's 3 of us, which is great. And the reason why it's so good for me, and we were talking about flexibility, I have 2 kids. I also work on another job in the public health field. So I'm the oral health coordinator in Maine. And so I'm able to do that 2 days a week, and then I have a solid 3 days, and I was able to stretch out my hours so that I get more hours on in those 3 days. So the flexibility is there. And so having 3 of us, we can see more patients. We have a ton of, I mean, because of COVID, we're like everywhere else backlogged and everything. So yeah, every office is a little bit different, as you know. But yeah, it's really great. I feel really fortunate to be in a 3 hygiene office.
It's all about just breaking down those barriers to care. We have financing to help them break it down into monthly payments. We have an on-site denture lab to help them get dentures faster. We have late nights available, early morning appointments available, Saturday appointments available. Really, everything that we do is in an effort to make it easier for patients to access care so they can say yes to treatment. We have our specialists come to the office. We really do whatever it takes to help patients get the care that they need. And that's why I love what I do. That's why I love working here, because I see the effort that goes into making it easier for patients to get their care.
Okay, thank you, Sarah. Jackie.
So I view it in 2 separate ways. And so with my role and having hygiene managers and hygienists, I echo what Sarah and Dr. Divya said. That yes culture for our patients is so important. They walked through that door for a reason, and the last thing that they want to hear is no. So we are there for our patients. But for me, on a managerial level, I see that as yes to my people as well. So just like Amber said, I can text Jackie with any questions that I have. I could easily push that phone away and say no, but I don't. So that yes culture follows in your managerial roles for your people. And one of Aspen's, trying to think of the right word, but one of their words to live by is the patient experience should not exceed the team experience. And if our team members don't feel supported and we don't have a yes mentality with our team members, they aren't going to have that mentality with their patients. And so that flexibility is important. We try to say yes to our team members, just like we try to say yes to our patients.
Great. Amber?
For me, it's looking my patients in the eyes and telling them that I can help them, that I can get them to be healthier, that I'm here for the long road, that I'm here for the long haul, for the patients that need that, and even for the patients that don't. I see my job as, I also see myself as so much more than just cleaning teeth and treatment planning. My patients sit in my chair and tell me about their lives, and we connect on another level. And so for me, part of that yes experience is knowing that they can come see me every 3, 4, 6 months, and that I'm going to be able to, embrace them in all forms, in every aspect, their oral health, their personal life, everything. So that's part of my yes.
Great. And I will just give my 2 cents before we go ahead and sign off here. And as a hygienist for so long, I felt like I was undertreating my patients for years. I wasn't able to really do the treatment that I felt necessary. I felt like I was held back. So yes to me is to be able to that treat my patients the way I felt needed to be treated. And that's why I love being able to talk to students and breaking down those rumors and all of the bad and negative things said about Aspen in particular, because I feel like we do what should be done in a dental office. So thank you all for your time. If anybody on the attendees would like to reach out to me directly, and I can get you in contact with a manager in an area that you want to work in, please don't hesitate to do that. I've added my email on there. So thank you all very much. Have a great evening. You were wonderful panelists. Thank you.
Bye. Thanks, Holly.
Bye.
Bye,
Talk to you later, guys. Bye-bye.
Bye. Thank you.
Bye.
Bye-bye.
Azal.